Welcome to today's Tuesday topic. Today's topic is listening with the ears of the heart, developing listening skills to be more present, available, and empathetic with patients. With us today, we have Professor Nick Anselmo, the Director of Theater and Mandell Professionals in Residence Programs, Bobbi Block, who is a teacher of improvisation for theater and theater for career and life, and Adrienne Banning, who is one of our faculty members from the Assistant Physician Department. And so without further ado, let me throw it over to you, Nick Anselmo. Take it away.
So as Darren said, I'm Nick Anselmo. I'm the head of the theater program here at Drexel. Adrienne, did you want to introduce yourself, and Bobbi as well?
Yeah, hi, my name is Adrienne Banning. I'm an associate clinical professor in the PA department, physician assistant. Thanks for being here. Bobbi?
Hi, my name is Bobbi Block. I am adjunct faculty teaching improvisation in the performing arts department.
And one of the things one of my mentors always says is we have to learn in the theater how not just to listen actively, but to listen on a deeper level and to actually listen with the ears of the heart. So that was one of the reasons why we chose that title for this discussion. Just briefly, I've been at Drexel for 16 years, and before that, I was teaching at a community college in New Jersey, and I've spent most of my time teaching students who were studying for fields other than theater. And what I've learned is the skills that we employ every day in the theater really help you in any career where communication is important, but especially in the medical profession, where listening and empathy, strong collaboration, and the ability to be present and think and respond quickly in high-stakes environments is incredibly important. So what we're going to talk to you is how do we train students to do that? How do we help them figure that out so that they do it automatically? And one way is through medical improv. Beth Boynton, who has been a nurse, practicing nurse for over 30 years, she's also a certified applied improvisation practitioner, has written 3 experiential handbooks on how to train medical professionals to listen better, listen more actively. And this is how she defines medical improv. Medical improv is an exciting teaching tool that can be used to promote emotional intelligence, communication, teamwork, and leadership skills in healthcare professionals. It is different from improv comedy because the focus is on learning instead of performing. In this emerging field, practitioners adapt experiential activities from the world of improvisational theater to build skills and impact key outcomes such as patient safety, patient experience, workforce health, and cost effectiveness. We found this really incredible video by Dr. Belinda Fu, who is also called the Improv Doc. And she is an associate clinical professor in the Department of Family Medicine at the University of Washington, a doctor of family practice, a professional actor, and a theater sport ensemble member, and improv instructor at Seattle's Unexpected Productions. And she is also the founder of an educational consulting company called Mayutika LLC. And she did this incredible video called Teach Doctors Improv, and we want to share that with you.
Picture this: a large wood desk in a medical office. A young woman, mid-30s, sits on one side, and on the other side, behind the desk, sits an oncologist, middle-aged, glasses. The doctor says to her, "In order to treat your early-stage cancer, you're going to need to have surgery. This kind of surgery is what we call a skinning procedure, and it can cause disfigurement. And if your cancer ever comes back, we'll need to do the surgery again and remove even more. Do you have any questions?" No, the woman stammers. "Okay, then please see the nurse to schedule your surgery, and I'll see you in the operating room." The young woman picks up her purse, walks down the hall, past the nurse's desk, and does not come back. That patient was me. Picture this: a clinic examination room. A young woman sits in a chair. She sits uncomfortably because she's recovering from recent major surgery and complications from which she almost died. Today, she is meeting her new primary care physician for the first time. And as she's explaining the details of her unexpected organ failure, the doctor turns away from her and begins to type on the computer. The woman continues to speak about her days in the ICU, her transfusions, her infections. The doctor continues to type, making eye contact only with the screen. Finally, the woman says, "Excuse me, but are you listening?" Startled, the doctor turns around. Yes. This time, that doctor was me. Both of these experiences have stayed with me for many years, heavy on my mind, as reminders of a difficult truth, that far too often, despite our best intentions, doctors do not communicate well. Well, there are many contributing factors to this. One of the most critical reasons that doctors lack communication skills is simply that they were never taught. As a professor of family medicine, I know that our current methods of teaching communication skills to doctors are not enough. Discussions and videos are not enough. We need skill-based training, much like athletes and musicians have exercises and drills. Mnemonics that say E for empathy are not enough. We need to teach the behaviors that enable sincere compassion. Scripted dialogue is not enough. We need to teach flexible skills that enable adaptation to the individual needs of each patient. I believe that the skills of improvisational theater can fill this need. In addition to being a physician, I'm also an improv actor and teacher. I started taking improv classes just for fun, but as I learned how to improvise on stage, improv skills began appearing in other parts of my life, and I discovered that those skills were making me a better communicator, a better doctor, and a better person. Improv theater teaches communication micro skills. For example, how to recognize verbal cues, such as tone or silence, how to use nonverbal cues, such as posture and eye contact, or how to perceive and express a wide range of emotions. Improv teaches how to improve awareness of one's environment, how to remember specific items to use again later, and how to be nimble in thought and action, or how to shift focus in a conversation from one person to another. These are just examples of skills. There are hundreds more. It's actually not about being funny. Humor in improv is simply a welcome and natural byproduct of sincere and skillful communication. Improvisers learn these skills through exercises. For example, a student might be instructed to choose an emotion and then simply say hello to a fellow student while attempting to sincerely convey that emotion. The other student must then respond by attempting to identify and name that emotion and to physically mirror it as well. This exercise continues in multiple rounds with different emotions each time, increasing in complexity as students improve their skills of emotional perception and expression. This is just one example of an exercise. There are hundreds more. Through these exercises, improv can teach physicians how to support their patients and colleagues, how to heighten awareness and observation, how to adapt to unpredictable circumstances, and how to move conversations forward in a constructive way. These abilities are essential to addressing healthcare concerns, such as patient safety, patient satisfaction, medical errors, conflict resolution, and creation of a safe learning and work environment. The communication skills of improv are the same communication skills needed by doctors, so let's teach doctors improv. Medical improv is the adaptation of improv principles and methods to the context of medicine for the purpose of improving communication, well-being, and collaborative patient care. I'm committed to sharing this idea because I'm convinced that this can make a positive difference in people's lives. Picture this: a clinic examination room. A middle-aged woman sits wedged into a chair in the far corner of the room. She appears older than her age. Her hair is thinning, her glasses smudged. She's frowning, she's trembling. Her arms are wrapped around herself. She is my patient, and as I enter the room, she begins to yell. "My daughter's dying, my grandson's been abused, they're going to cut the utilities off, my pain is getting worse, and you're not helping, you're making it worse." Finally, she stops, and we sit there in silence. I sit lower in my chair, like she is. I roll my shoulders in like she is. I look into her eyes and simply say, "You're scared." And quietly, she starts to cry. "Yes," she says. "Yes, I'm scared. All I really needed was someone to listen." Teach doctors improv, and they will be better doctors. Thank you.
So you have just seen Dr. Fu's video, which we think makes a pretty compelling case for the skills that you can build into medical education or even your own practice when you incorporate theater techniques, acting techniques, specifically improv, into medical education. We generally are people that go into a healing profession because hopefully we've been able to express empathy and compassion and listening skills, at least to some extent, but they don't have to be inherent. And even if they are, they can be taught and cultivated, something that we're going to need for the entirety of our careers. I'm a huge proponent of incorporating the humanities into medical education just for that. People come to us, yes, because of our skill and our knowledge, but they want to feel better and feel heard and have their concerns be validated. And they are all things that we do as humans, connecting with other humans. And that comes from practicing the humanities, not just experiencing them, but actually practicing them. So we have a lot of evidence, a very rather deep set of evidence, actually. And we've got a few select references at the end that you can look at that back up why this is important. The Association of American Medical Colleges has published a book on the topic and how to incorporate it. There's an important review from 2016 called The Guiding Framework to Maximize the Power of the Arts in Medical Education, not just a systematic review, but metasynthesis as well for my EBM people in the room. And how do we know that this works? It is supported by evidence. It shows that it builds trust between the people who are participating and can build trust between providers and the patients. With better communication, we know that patient satisfaction and safety goes up, helps in conflict resolution, because this isn't just between our patients and ourselves, our clients and ourselves, but also with each other. How many times has there been a miscommunication, maybe at work? Helps you improve your environmental awareness and responsiveness, ability to shift focus. Some have said there is no such thing as multitasking, but certainly there is switching between tasks very quickly as we can. If you are someone who likes to know that what you're doing has been done before, other people are doing this. They have had success. It's being done at places you've heard of, like, Harvard and Northwestern and the University of Washington, Arizona. Stony Brook is doing it. And actually, some of you may know Alan Alda from MASH. He has a book called If I Understood You, Would I Have This Look on My Face? He has realized that he's used a lot of his acting training to communicate, and especially to help scientists and clinicians communicate better. And he actually has a center at Stony Brook where they use these techniques specifically. Maybe Drexel will have a center someday. Maybe this is the beginning of it. We don't always do a great job communicating. We know that when our patients are unhappy, haven't been communicated with well, don't feel cared for, they're more likely to sue us as well. So we want to improve all of these things. We have the evidence that backs it up. Other schools are giving value to this. In the end, we want to educate highly qualified healthcare providers and therapists. And we think that this is another tool and something different that we could add to our curriculum. The next slide will give you a little insight into what students might think of it as well. This is a student response to a theater exercise from the literature. And you'll see that after a workshop, students were surveyed, as we love to do. Was this training beneficial? Yes, that's subjective. Yes, that's anecdotal, but do they like it, or will they run away screaming? 41% said it was somewhat beneficial, but 59%, which gives you a quick add of 100% there, says that it was very beneficial. So no one said that they hated it. And would they recommend this? Yes, they were somewhat likely to recommend it, but everyone else said that they were very likely to recommend it. So they liked it and they would tell other people to do it too. Nick, back to you.
Okay, so what we then want to do is give you an experience of what we're talking about. And so I will hand this over to the amazing Bobbi Block. Bobbi, take it away.
All right. Well, hello everyone. I hope that you absorbed everything that was said by Dr. Fu in in that terrific video. And you saw everybody standing up in a circle in that video and interacting and doing an exercise together. And that's really what this is. It's about the experience. We could give you a lot of facts and figures, but we really want to give you an experience of what using applied improvisation feels like, and how specifically, as we see on this slide, there are so many objectives that we could hit with thousands or hundreds, let's say, of different exercises that we have in improv. And one of the exercises that we'd like to share with you works on the idea of releasing preconceived ideas, or pre-scripting, or being prescriptive with patients or colleagues when you're in conversation, and instead being in the moment with your patient or with your colleague, and really listening to what's happening here and now and building off of that. And in that way, building trust with each other, that you're fully present with each other and really connected and engaged. So in order to work on that, I'd say, Nick, we could take this slide off of the, or we can just take all the slides off. And I'm seeing that there are a lot of cameras off right now. So I'm going to invite you to turn your cameras on. So I'm making an invitation to turn your cameras on. Hello. Thank you for saying hello. Hi, Megan. I see Jariha? Am I pronouncing it correctly?
Girija. It's exactly as it's written.
Yerija. All right. Thank you, Yerija. Brenda, Karen, Megan, hello. Thank you so much for being with us. I also see some cameras that are still going to remain off, and I understand that you know, whatever your reasons are, we get it. If you can listen in and get what we're talking about by listening, that's great.
Bobbi, I'll use this chance to unmute a second, and just first, on behalf of the Faculty Affairs Committee, just thank your group for this presentation. You have me hooked and intrigued. So I'm just so excited to be here. I'm very, very significantly under the weather, so that's why my camera's off. So I just wanted to explain that, but say I'm really loving it. So thank you, and I look forward to participating in the way that I can. Okay.
Yes, thank you, Lisa. Would you mind being put into a breakout room to have you don't have to turn your camera on in the breakout room, but could you have a conversation with somebody in a breakout room?
Sure.
Great. All right. Thank you. All right, everyone. So here's what we're about to do. You are now inventors. You're going to invent new products. We're going to put you in a breakout room for literally 60 seconds. It'll be real quick. And all I want you to do is talk to each other about inventing a new office chair. Right? We're all sitting in our chairs at home or at work, whatever. Invent a new office chair. And one of you is going to say, hey, let's invent a new office chair. And then from that point on, the only way you're going to start your sentences is by saying the words yes, but. So you'd say, let's invent a new office chair. And then the other person would say, yes, but it has to be purple. And then you'd say, yes, but I need big cushions on it. And then, yes, but blah, blah, blah. Yes, but blah, blah, blah. Now, if you open up your chat box, your directions are in the chat box. Dun, dun, dun. So if you forget what to do, you can always look in the chat box. So you'll go into the breakout room. Somebody would say, let's invent a new office chair. You'll yes, but each other. And in about 60 seconds, you'll fly back into this room and we'll give you the next set of directions. All right? Okay. Nick?
There you go.
Everybody. Thank you for yes butting each other. Keep that conversation sort of in the back of your mind. Now I'm going to shift it a little bit. So you're going to have a new partner, a new inventor person who's going to invent something with you. We're going to stick with the chair. So you're going to say, let's invent a new chair, but this will be with a new partner. And you have new a new way to start every sentence, and that's by saying the words yes and. So you'll say, let's invent a new chair, and you'll say, yes, and let's make it purple. And you'd say, yes, and blah, 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 yes, and blah, blah, blah. What you want to try to avoid is asking questions. Try not to ask any questions. So not, yes, and what color should we make it? But yes, and it should be blue, right? So yes, and no questions, invent a new chair. Hello, everyone. All right, great. So you just had an experience of saying yes, but to somebody and then saying yes, and. Can you just talk to me about the differences of those two experiences?
I thought yes.
Unmuting is it's always tricky. Yeah, Megan, go for it.
I thought yes and felt a lot more collaborative, like we were working together.
Great. I see some nodding. Do we see agreement there? Was yes and more collaborative? All right. Any other thoughts about it?
I felt like yes, but was disagreement, that I was acknowledging Karen's ideas in the first round, but also implying that I didn't think that they were great, but I did. And it was hard to say but.
Understood. Well, so what's interesting is, well, let me ask you another question. How did you feel when you were yes butted? You can unmute yourselves and just shout it out. You don't have to raise a hand or anything. Was there a feeling when you got yes butted? Well, I heard disagreement. Is there a feeling when somebody says yes but to you?
It feels like pruning, you know? It feels
Okay.
like sort of cutting down in a way that yes and is building. So
Nice. It feels like pruning when yes and is building.
mhm.
Any other thoughts?
Yeah, I agree. The yes, and we had much more excitement. Our chair was
Yes,
much more
our chair was awesome.
elaborate. Our chair was was going into a spa.
Yes.
Great. Good. All right. So let's just unpack this just a little bit. So yes and often makes people feel a little defensive or dismissed, or as you say, Jiraja, that you're getting pruned, right? So like, I kind of like what you're saying, but I want to pick and choose and maybe get mine in there, right? So yes, but can sometimes be experienced as no with a smile. And no with a smile is emotionally incongruent. So you've got a smile, which is positive, and the no is negative. So emotional incongruency is a deterrent to authenticity. It makes people stop trusting you fully. So what you want to do is be emotionally congruent. If you mean yes, say yes. If you mean no, just say no. Don't say yes, but. So yes, but is often something we choose to placate or, play nice, or I want to, be a little bit positive with you, but I really have my own agenda and I really have something that I want to get in there. So we suggest, if you're having a collaborative conversation and you want to connect, yes, and. If you're having a prescriptive conversation and you need to give directions and make a decision, just say no or say yes or say your piece. Watch out for the yes, but. It's a mixed message. Now, we could unpack that for a long time, but I want to give us another 2 rounds where we're going to explore yes and a little bit more deeply. So in this next round, you're going to pair up and you're going to say yes and to each other, but I have a couple more things you're going to say. So number 1, I'm going to give you a new product this time. We've made great chairs. We're going to make something else. This time, I'm going to ask you to make what I call a short offer. In improv, anything you say or do is an offer. So if I walk on stage, I go, "Hi, Mom," that's an offer. If I walk on stage like this, that's an offer, right? So everything is an offer. And in improv, we teach people to be very aware of what people are offering. So I want you to make short offers. I don't want you to talk on and on and on. Like, let's make the chair green because green is a really great color and I think green goes with everything. And I really think the green is the latest. Just say, let's make the chair green and then move on. All right. So short offer. The other big thing you're going to do this round is you're going to treat your partner like they're a genius. and that you've never been so lucky as you are on this day to work with this person, because everything they say is absolute genius. So whatever they say to you, you have to greet it with, yes, and, right? Here's the kicker though. Even if you don't like their offer. So if they say, let's make a chair that has spikes sticking out of the cushions when you sit down, and you think that's insane, your answer in this exercise has to be, yes, and then you got to do something with your spiky chair. Okay? All right, so in the chat box, we have our directions. You're going to invent a new pair of sneakers. You'll say, let's invent new sneakers. Then you're going to say yes, and you're going to make short offers, and you're going to treat your partner like a genius no matter what they say. All right? So go experience that for 1 minute, and then we'll come back and we'll talk about it. Off you go. Welcome back. It's always nice to see smiling faces when you come back from the breakout room. Okay, so the big question now is, what's it like to be treated like a genius? You can
makes you feel good.
Makes you feel good. Thank you, Lisa. And you're not feeling well, so I'm glad it made you feel good. Great. And what does being made feel good have to do with a collaborative conversation?
Uplifting, the flow.
It's uplifting and it keeps the flow going. Great. How likely are you to collaborate if you feel that the other person isn't valuing what you have to add to the conversation?
Is invaluing, is not valuing it.
Not valuing it. Yes.
Right. Yeah, not very likely. It felt a lot safer. Like I could say something and Brenda wasn't going to make fun of me for it. That we could get farther with it.
Yeah. And how would you see something like that, this idea? So improvisers embrace the idea that every offer is a good offer, or every offer is worth exploring, basically. So how would you see that in relationship to maybe talking with a patient?
Being open-minded.
Great.
I would also say flexible. We can have a prescriptive plan for a patient, but if it's not patient-centered, if it's not something that they're interested in, certainly they're not going to proceed.
Right. And what about, your role as the expert in the room, right? Can you say more about that and treating somebody like they're a genius or they have value, even though you're the one with the label of I am expert?
It might help you like invite your patient into the conversation more to make it more of a collaborative project, even though probably much of the knowledge is going to be coming from you, but just inviting them to participate in it.
Right.
And it acknowledges that they're an expert on them and their family. So you're not, so, and really acknowledging that.
Yeah. And how can that benefit you if you give them this space to be an expert on them? How does that benefit you?
They're more willing to work. Oh, sorry.
Brenda and then Karen.
They're more willing to work with you, and maybe not with you is the right word, really as a team. I think inclusion in that patient-centered team is so important. Pardon me.
Great, thank you. Karen?
Along with what Brenda said, they start to trust you more, you build a rapport, and they'll start sharing more with you.
Great. So trust, building rapport, and then they share more. And of course, the more they share, the better treatment you can provide, right? If somebody doesn't feel that they can trust you, they're not going to open up and share that. That's a great segue to the last round. So the last round of this yes and is the listening round. We're really going to work on a different kind of listening. So you could yes and somebody without ever listening to them. You could just sort of pay lip service to yes-anding. So you could say, let's make the chair purple. And then your partner says, yes, and let's put some wheels on it. Yes, and let's make it fly. Yes, and let's make it smell good. Yes, and let's make it spin around. Yes, and let's make it give you a massage. Right? So I'm just listing stuff and you're listing stuff and we're not listening to each other. We're just listing stuff, right? So we call that piling on as opposed to building on. So improvisers are really interested in building on the last offer that was made. So when you hear whatever your partner gives you, your job as the improviser or your job in this exercise is to listen to what they said and figure out a way to connect to what they just said, which is hard. So for example, back to the chair, if I said, let's make the chair green, what does your next offer in these rules, what does your next offer have to be about? If my offer is about green, what does your offer have to be about?
Building on green.
Building on green.
Okay.
Got it? Building on green. So whatever you feel like, there's no parameters around that, but it has to connect somehow. So I say, let's make the chair green. And then my partner says, okay, yes. And let's make the chair out of grass. Great. Then what does your next offer have to be about? No, all of you are muted. So if you're saying it, I know you've all got the answer. Yes, thank you, Karen. Okay. It has to be about grass. Great. So, I don't know. Yes, and let's make it smokable grass. Right? Great. Then what does your next offer have to be about? This wacky chair that's being made out of smokable grass. So we'll see how that goes. Who knows? Could be a great new product. So what you want to do is listen and build off of the last offer. What sometimes happens is that you listen and build, and then you hit a wall. If you hit a wall, that's cool. Then you can bring in an idea out of the blue, but try your best to build on the other thing the person just said until you can't go anymore. Then you can bring in a new idea. I look at this a little bit like playing with Legos. You're both bringing a pile of Legos to the table. You could just throw your Lego onto the table and this is my Lego. Well, this is my Lego. And at the end, you got a pile of Legos. Or you put out a Lego and you try really hard to connect your Lego to their Lego and then connect and then connect. And then at the end, you've got a structure. You've got a product. Okay? All right. So we've got new directions in the chat box. This time you're going to start with, let's invent a new bike. And you're going to do all the things we talked about. You're going to say yes, and you're going to build off of the last offer that was given. That's the hard part. You're going to make short offers. You don't want to overtalk it. And you still want to treat your partner like a genius. And remember, make statements, don't ask questions. All right? Okay, let's invent a new bike. Off you go. All right. Smiling faces again. Good. So typically people report that this is just a little bit harder or different in some way because of that listening element. So can you speak to that? What was your experience like? Describe how it was. Megan, I see you nodding, so I'm going to grab your nod and ask you to talk about it.
Yeah, I think it was a little bit, and maybe I was still trying to anticipate, and already be thinking about how can I, wherever this goes, how can I add on to this? And so maybe I wasn't as in the moment. I think maybe that's one of the challenges, to just listen and not think about what you're doing next.
Yes. Well, I'm delighted that you said that. Does anybody resonate with that? Just listen and don't think about what you need to do next. Does that feel like a challenge that you might have sometimes? Maybe Karen saying yes. Well, this is kind of the crux of improvisers. Improvisers are other focused when we listen. So in this round, I'm asking you to release your preconceived ideas of what you want this bike or sneaker to be and only build off of what's in front of you. That is super hard. And if any of you had difficulty with it, you are perfectly normal. What improvisers do is we practice that, like a lot, like in drills. We practice, practice, practice. A lot of theater artists practice listening in this way. Really relaxed, really open, ready to accept what is happening here and now. This is difficult, especially for people, in healthcare or people in expert positions, because you want to help. You want to say, look, I've got your answer right now. I want to tell you what I need to tell you. You want to jump ahead. And all of us know that when you're in that position with a doctor, with an expert in any field, when they are not listening to you, when you can see in their eyes that they are just formulating what they need to say next, you start disconnecting and disconnecting. So what this exercise is teaching is to not anticipate, to rather build on what's happening in the moment. And what that does is, instead of disconnect, it brings you closer together. And it builds trust because the other person feels heard by you. If you say, let's make it green, and then you say something about green, well, then I feel heard. And if you do that over and over and over, I'm going to be heard and heard and heard. The value of your patients feeling heard by you is that they will start to trust you. And the value of them trusting you is that they will be more compliant with when you do get to the point where you need to influence and prescribe. So when I work in healthcare, I'm often asking, be patient with this process. First, you need to build trust. Then you can influence people. But you got to do this connecting and listening thing first. So that's the power of yes and. And I'll say one last thing about improvisers and yes and. People think that improvisers have this wealth of knowledge in our heads, like we walk onto a stage and we have 5,000 amazing ideas. We do not. We don't have that. What we have is the ability to just release all those ideas, be present, and what happens in the moment bubbles up and we grab that as an idea. And that's the kind of skill that we would bring of so many, many, many skills that you've heard so far in this whole presentation. That's one of the skills that we would bring to the table, that idea of being present and working with what is right in front of you. Any other thoughts about this yes and? In improv, it's called accept and build. And in improv, we'll always work with that. Again, if somebody comes on and says, hi, mom, and I'm thinking, I didn't want to do a scene about a mom. I wanted her to be my teacher. I'm not going to go, I'm not your mother. I've never met you before. We don't do that. If you say, hi, mom, I'm your mom. We say yes to that. We let go of any preconceived idea that we had for what that scene was going to be about. All right. Last words about the exercise. Give me a thumbs up if it was fun. Great. Give me a thumbs up if you learned a little something about your listening. Oh, I do want to do the breakout. Should we do a little breakout debrief, Nick? Yeah, let's do it. We're just going to do a very quick breakout where I'd like you to just discuss with a partner your own strengths and challenges with being in the moment versus pre-scripting. What are your strengths and challenges with being in the moment versus pre-scripting? All right. And do we have that? There you go. All right. Off you go. All right. Oh, everybody's back. Okay. Well, thank you for participating in this one exercise of so many. And I'm going to just pass it over to Nick to do, wrap it up a little bit or give us a little other piece of information.
So I just want to share with you another video with it's by Karen Stobie, who is a TED Med video of applying these principles to training people to work with people with dementia and Alzheimer's.
Say yes and.
Agree, don't deny.
Accept offers and gifts.
Be specific.
Listen fully.
Accept the reality given to you.
Go with the flow.
Share focus. Give and take.
Silence can be powerful.
Commit 100%.
Be in the moment.
Those are some of the guidelines for performing improvisation.
Those also happen to be some of the guidelines for being with a person who is living with Alzheimer's.
My name is Mundy Carter. I have a degree in philosophy and theater, so I can really think about not working. I met my wife, Karen, while performing improv.
My name's Karen Stobie. I love performing, but I'm lousy at memorization, so I took up improv 30 years ago. My dad, Manfred, passed away from Alzheimer's disease in October of 2000, and my mom, Virginia, has been living with Alzheimer's for the past 13 years. I realized in caregiving for both of my parents that the guidelines for improv and the guidelines for being with a person with Alzheimer's are parallel.
And we say guidelines because really there are no rules for either. Also, you can't rehearse either one. But in improv, there are games and exercises that practice the guidelines. You do those a whole lot, which builds up a set of habits. So without even thinking about it, you follow those guidelines on stage.
And since Alzheimer's affects everyone in an individual way, you really can't prepare for each interaction by sitting in a classroom or reading a book.
But since improv and Alzheimer's are similar, you can use the guidelines of improv to break through to a person with Alzheimer's.
One of those guidelines is accept the reality given to you, or step into their world. Ma'am, right there, could you give me an occupation, any occupation? A dancer, thank you very much. So we'll see what that looks like. All right, we have auditioner number 22.
Yes.
All right. Okay,
Ready
anytime you want to start.
This is a little mixture I like to do between street dancing and ballet.
Okay.
I just need a little warm up here.
Anytime you're ready.
That's fine.
Oh, I'm sorry. Oh. So,
I'm just getting started.
Mundy accepted the world that I just gave to him, the world of being a dancer, and he went with it. He could have denied it and went with an idea he already had, or he could have tried to keep me in this reality and there would have been no scene. Sometimes it's incredibly hard to accept and jump into the world of a person with Alzheimer's. Accepting their reality means letting go of ours.
Oh, on the radio. They said that song was by the Beatles. I knew them.
Now, our first reaction is to not jump into their world, but try and pull them back into ours. Oh, there's no way you really knew the Beatles. I'm sure you just heard them on the radio. But what we can do is accept where they are and jump into their world.
They said that song was by the Beatles. I knew them.
Wow, that's amazing. Tell me about it.
It was amazing, but there were all these girls screaming all the time. It was a little frightening.
Stepping into their world provides a launching off pad that is positive instead of a response that is negative. It provides a connection you can talk about, have a conversation.
We're proposing that there would be a practice or skills-based training that's, as Bobbi said, something that would continue, something that would be ongoing as opposed to maybe an introductory course. I like to say that, Dr. Fu said we need to train medical professionals the same way we would train athletes or musicians through drills and skill-based training. So what we're proposing is that we would deliver an interpersonal 1 credit practicum class or practice class, asking students to take an hour a week of improvisation to work on the skills until they finally could own those skills over the course of 3 quarters. And then they could be applied in areas like the simulation center. Adrian, do you want to add on to that at all? Or anybody else?
Yes. And
Yes.
we think that this could be something that everyone in CNHP could do, but really anyone across the university. I think, as you've seen today, there's not one profession or one student or one faculty member who couldn't benefit from increased communication and, frankly, being made to feel like they're a genius as appropriate. we think that we could carve out time. We certainly have the right space in the simulation center for it. It could be an elective. It could be something that's already tucked into your curriculum in a different way. You don't have to reinvent the wheel. In the PA program, we have a patient communication class. We don't have to make a new class for it. We can incorporate those things here, and we would really like to work with anyone. So we hope that it has at least opened your eyes to the possibility. And then if you do see this coming along, maybe through Course Leaf at some point in time, you think, I know what they're talking about. Yes, and I'd like to see it happen.
And then finally, these are just some of the outcomes, student outcomes that you get. Bobbi, did you want to add something?
No,
Oh.
no, I'm good.
So, and students will be able to be more present and available, all the things we've been talking about all along. So I think at this point, we could stop and ask if there's any questions or any comments.
I do have a question as we were going through this. Bobbi, Nick, do you ever see these techniques being applied for mindfulness? That's something that we've talked a whole heck of a lot about during the pandemic, to be in the moment.
Mm.
Yes, there's a whole field of applied improvisers who use improv for mindfulness practice. There's a colleague of mine wrote a book about it. Yeah, I mean, it's all the same, being in the moment, for sure. Yeah.
Yeah. And I think even more, like, Adrian, to your point, like during the pandemic, I think these skills and this type of training is even more important because we're just so much more siloed, more separated. It's good for our health. It's good for our interactions with others.
Yeah. I don't know if you see this in your programs with the PA students. We often see a huge fear of failure, some toxic perfectionism, fear of being wrong. And we think that this could also help with that as well, providing psychological safety and getting used to just communicating, experimenting, and recognizing that you don't have to be perfect all the time. You can improvise. So, yeah. Thank you for all the beautiful comments in the chat. And I want to thank the Faculty Affairs Committee for co-sponsoring this Tuesday topics. And I especially want to thank Nick and Bobbi for coming along and doing so much with CNHP. So thank you to everyone and happy Thanksgiving.
I before we go, I thought I saw somebody who had a question. I didn't want to stifle that.
I was just going to share something that normally in anything that's kind of acting related or role playing, which I know improv has different guidelines, right? But I have to say this felt safe, felt comfortable. I didn't feel like, oh, just because I'm not really good on acting or something that I'm going to be. So it was natural. It was much more natural than I thought to take part in the exercise and just to also just hearing the information that you shared. So thank you.
Great. So glad you had that feeling. Okay. I thought I had seen a hand raised or a phone show up or something.
I clapped. I was clapping.
Oh, it's clapping. Oh, okay.
I was clapping.
Got it. That's what I saw.
Right.
Well, everybody was delightful to work with. Thank you so much for being jumping right in and doing something out of the ordinary. So thank you.
All right. Well, thanks everybody. We'll see you next time on Tuesday Topics. Thanks.
All right. Thank you all so much.